So if you're battling that stubborn, annoying heel pain, you've probably scrolled through countless remedies online. But what does the science actually say? Well, today we're cutting through all that noise. We're going to break down the official 2023 Clinical Practice Guideline from the experts at the American Physical Therapy Association to find out what really works. You know exactly what I'm talking about, right? That moment you swing your legs out of bed, your foot touches the floor, and ouch! It's like a sharp, stabbing pain right in your heel. It might get a little better as you move around, but man, what a brutal way to start the day.
If that little story sounds way too familiar, then you're probably dealing with plantar fasciitis. And listen, if you are so far from alone. This thing is responsible for about 15% of all adult foot problems. It's incredibly common.
Okay, so with a million different suggestions out there, special socks, weird gadgets, you name it, how do you figure out what to do? You go straight to the experts. This whole explainer is based on this massive 2023 guideline, which pulls together all the best research into one clear set of recommendations.
And the best part is they made it super simple for us. Think of it like a report card for every possible treatment. A means there's strong evidence it works. B is moderate. C is weak. And D means the science is all over the place. This little grading system is basically our roadmap for the next few minutes.
All right, let's get right to the good stuff. We're starting at the very top with the A list. These are the treatments that got a grade A for strong evidence. According to the experts, these should be the cornerstone of any effective treatment plan.
First up, manual therapy. This is basically hands-on treatment from a professional, like a physical therapist. They work on mobilizing the joints and soft tissues in your foot and lower leg. And the reason it gets an A, the evidence is crystal clear, it works to decrease pain and just plain helps you move better.
Next on the A list is stretching. But, and this is a big but, not just any random stretching. The guideline is super specific. We're talking about stretches for the plantar fascia itself and for your calf muscles. The real magic here is that the evidence shows this helps with both immediate pain relief and long-term improvement. That's a huge win.
Taping also makes the A list. This could be with supportive, rigid tape or that flexible kinesiology tape you see everywhere. Now, here's the key takeaway. Taping is a rock star for short-term relief. Think in that 1 to 6 week time frame. It's fantastic for calming the pain down and giving you some immediate breathing room.
And our final grade A treatment is the night splint. Now, this is specifically recommended for people who have that consistent, awful first step pain in the morning. You wear it while you sleep for about 1 to 3 months, and it keeps your foot in a gentle stretch. This stops that tissue from tightening up overnight, making that first step a whole lot less shocking.
Okay, so that's the A list. But what else is out there? Let's move on to what we can call the good bets. These are treatments that have moderate or maybe weaker evidence, but they can still be really helpful parts of a plan.
So this next group is a bit more varied. As you can see, we've got things like dry needling and low-level laser getting a solid B grade. Then you have foot orthoses and other exercises with a C grade. Still potentially useful, but the evidence isn't quite as strong.
Let's zero in on those grade B recommendations for a second. With moderate evidence backing them up, dry needling and low-level laser therapy are definitely considered powerful secondary options by the experts.
So for dry needling, the guideline says that when it's targeted at those tight trigger points in the calf and foot, it can help reduce pain for both the short and long haul. And low-level laser therapy gets the nod for its ability to decrease pain, mostly in the short term. And what about shoe inserts or orthotics? This is a really important one. The guideline gives them a C and is very direct, saying they should be used in combination with other treatments. So they're not meant to be a standalone fix, but more of a supporting player to things like stretching and manual therapy.
Just as important as knowing what to do is knowing what maybe not to do, or at least what to be skeptical of. So the guideline also flags a few treatments where the evidence is shaky or even advises against them. Take electrotherapy, for example. It gets a D grade because the evidence is just all over the map. The guideline pretty much says clinicians should prioritize the things we know work, like manual therapy and stretching, instead of electrotherapy for getting long-term results.
And check this out. This is how specific this guideline gets. There's a grade A recommendation to not use therapeutic ultrasound, hoping it will make your stretching more effective. The strongest level of evidence says it simply doesn't add any extra benefit. That's powerful information.
Whew, okay, that was a lot of information. So let's boil it all down. What's the bottom line? Let's put this all together into a clear action plan that you can actually use.
Here it is, your evidence-based toolkit.
Your heavy hitters are the grade A treatments: hands-on manual therapy, those very specific stretches, and taping for that quick short-term relief. Then you have a strong grade B contender in dry needling for more lasting improvement. This right here is the core of what the 2023 guideline says you should focus on.
Look, the goal here isn't for you to go it alone. The goal is to make you an informed, confident partner in your own recovery. Now that you're armed with the highest quality evidence available, you can have a totally different conversation with your doctor or physical therapist. So, that leaves just one question. What will you talk about first?